Let's listen to an expert doctor, Dr. P.V. Balamurugan, Ishwara Hospital, Madurai. For hypertension in young population along with coronary artery disease and high heart rate can be sure of happy heart. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Myself, Dr. Balamurugan, MD in Internal Medicine. I am presently working as Associate Professor in the Department of Medicine, Government Sivagangai Medical College, and I am also a consultant physician practicing at Ishwara Hospital, Tallakulam, Madurai. Hypertension, a common non-communicable disease or a lifestyle disease which we are facing day in and day out, can be defined as a systolic blood pressure of more than 140 millimeter of mercury and or diastolic BP of equal to 90 or above is called hypertension, and we should measure at least more than twice to confirm that in two different places at two different times, and if it is more than that 140 by 90, we say the particular person is having hypertension.
Doctor, can high blood pressure be completely cured?
Usually, the hypertension diagnosis, once made correctly, it needs lifelong treatment. If there is no other secondary causes of rise in BP, systemic hypertension, otherwise called primary hypertension or essential hypertension, has no cure, but you can control it and keep it within the normal range so that there will be no complications. As such, it can't be cured.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Hypertension, a common non-communicable disease or a lifestyle disease, can be defined as a systolic blood pressure of more than 140 millimeter of mercury and or diastolic BP of equal to 90 or above is called hypertension.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Yes, there is a recent increase in many lifestyle diseases, including hypertension. We can trace this increase to a lot of reasons, including sedentary lifestyle, which is becoming very common, increased availability of unhealthy foods, and also increase in diabetes, and also increase in stress levels. Everything have contributed to some extent and has made hypertension very common, causes many complications like heart failure, stroke, and various other complications. And this can be attributed to many things, as I mentioned previously. But many of these conditions are preventable or modifiable. So once we modify it, we can bring it down.
Public awareness initiative by Glenmark Pharmaceuticals.